My name is Sophie G.
And my name is Alberto Sanchez.
Welcome to the podcast of the Multicultural Mental Health Resource Center. We're pleased today to speak with Dr. Lisa Anderman and Dr. Samuel Law from the University of Toronto. The occasion for our podcast today is the publication of an article that they co-authored with Dr. Danny Lee, appearing in the November 2012 edition of Transcultural Psychiatry. In fact, I understand that this article came directly out of Dr. Lee's research. Although she could not join us today, we are pleased to be able to speak with her co-authors. To introduce our discussion, I just want to say that what I found the most important contribution of this article is the proposal of social defeat as a factor in understanding schizophrenia among immigrants. In pointing to social defeat in their research, the authors give us a way of better understanding a whole set of research projects that have been identifying various social risk factors for delusion and schizophrenia. Drs. Anderman and Law, welcome.
Thank you.
Thank you.
So there's debate in the literature around schizophrenia that has to do with whether it's mostly explained through genetics or mostly explained through social determinants. Maybe you can give us the argument for the social determinant.
Mm-hmm. The example here we use is schizophrenia, and it is probably one of the most illustrative illnesses around, with the genetic loading to explain the illness around 50%. That is the monozygotic twins, while one with the illness, the other one will have about 50% chance of developing schizophrenia. So it provides a very eloquent model to understand the both nature and nurture aspect of illness. The best theory around that is called a two-hit theory, whereas one hit is the genetic loading, and the second hit is the psychosocial environmental factor. So in this case, what prompted us to think about this topic is really people working in this field have long known that other than genetics, the psychosocial determinants are very important as the second hit. A watershed article, I would say, is that inspired us is the Cantor-Graae from 2007, where the research of through meta-analysis found that as immigrants, you have 2 to 3 times the chance, higher than the average, which is about 1% in general population, of developing schizophrenia, which really throws the light on the psychosocial aspect of as an etiology towards developing schizophrenia. And it's much harder to understand the psychosocial aspect. Mm-hmm. Therefore, we have conceived this for this research project to look at within the psychosocial second hit, what are some of the aspects or what are some of the content of it. So I think there's a lot of research already, of course, about stress, negative events, unemployment, immigration, all those things. But they are kind of entities in isolation. And as our title suggests, we look at something a bit more understandable and a little bit broader and a little bit more cohesive, which is really a degree of social defeat.
Mm-hmm. Can you explain more about what you mean by social defeat?
I was just going to look for the definition that we used in the paper, which was looking at the subjective experiences of demoralization, incompetence, and difficulty in coping with stress, as well as exhaustion of one's resources, and comparing that to one's self-expectations. So that if you, for example, had a high degree of education and then had high expectations in the country that you immigrate to, and you end up being disappointed, let's say having a medical degree and then driving a taxi, that puts you at higher risk than somebody who might not have had such high expectations to begin with.
This is something that struck me, that even within the concept of social defeat, it seems like there's two aspects, particularly leading up to what you say about possible avenues for therapy, it seems that some of these things are things that happen to you and that individuals don't have much control over. Everything from genetics to certain kinds of social pressures and things that actually happen. But it seems like at least one of the aspects of social defeat that you mentioned just right now seems that it's something that we do usually consider that we do have control over, and that's expectations. I wonder if you can say anything about that.
I think one thing that will illustrate a little bit of this aspect is going back to the very landmark paper that I referenced to with Cantor-Graae was in the American Journal in 2007, where they compared the first and second generation immigrants, where father may have the family, or the father-mother family may have immigrated in their generation, and their chance of developing schizophrenia is about 3.2 around their percent. So 3 times higher than the average. That's kind of understandable if you buy the social defeat and stress model. What's really surprising to those authors who did the meta-analysis is that their children who were born in the new country or the host country, and their chance as second-generation immigrant who were born and brought up here, and their chance of developing schizophrenia is actually 4 times. That was very surprising, and one of the strongest explanations to that is a mismatched expectation and real-life circumstances. The presumption is that the second generation who grew up here would have a normal, probably an immigrant story of having succeeded in the new country, but sometimes their fate, their circumstances are much like their families. They're probably also, because of their skin color or accents, if they have still an accent, are much like that of their parents, and they have a kind of discrimination that if they experience that mismatching their expectation of their birthright or so. And that is one of those things that illustrate what we were talking about.
The study found a correlation between moderate to high levels of social defeat and delusions of psychological harm in immigrants suffering from schizophrenia. Psychological harm delusions would be like when you feel the TV is talking to you, feelings that you're experiencing mind control by an outside force, feelings of inordinate discrimination, whether perceived or real. Dr. Anderman, can you tell us what clinicians working with immigrants can take away from this study?
Well, I think one important part is really understanding the patient's narrative and the journey that they've made to arrive in Canada, what they've gone through. Even if it was many years ago, it can still be very relevant to their presentation. So understanding their degree of acculturation, how much they're still tied to their home country, how much they've integrated into life in Canada. We really use a cultural formulation approach to try to understand our patients' lives, and so that's one piece of advice. Kind of using the DSM for cultural formulation is one of the things that's woven through our clinical assessments. And the other part is that we've, specially chosen and hired our staff to be able to be familiar in language and cultural background with our patients, so that you don't take that part for granted, but you really try to make an effort to have them be as understood as possible. The article ends by mentioning the possibility that using cognitive behavior therapy, or CBT, could be useful to look at the severity and preventing relapse of delusions. Maybe not preventing relapse of delusion, but by looking, because CBT works by looking at evidence for and evidence against, by working with the patient's negative schemas of the world, the way they see themselves and the rest of the world, that this form of treatment in particular, CBT for psychosis, might be useful in working with some of these delusional beliefs, helping people to feel more safe in their new environment and be able to feel perhaps lesser degree of persecution than they might otherwise feel.
Mm-hmm. And I would say broader, and certainly as clinicians, we try to look for model that would have some impact. But thinking broader, has the wider implications, such as our immigration policy, having a appropriate and realistic expectations for people prior to their migration. And post-migration, certainly social policies, professional standardization kind of policies, all would be implicated in this in a broader sense. How we integrate immigrants, how we listen, how we incorporate their sense of self, aspirations, all into the clinical work as well as social policy. So I think these are provocative thoughts.
I'm intrigued by the finding you quote from the Cantor-Graae study that the second generation of immigrants have a higher chance of developing schizophrenia than their parents. How can we address the needs of children of immigrants?
It's a really provocative question. I think even as immigrants, or as an immigrant country, we tend to think the special considerations and the special considerations are really metered out towards the newer immigrants. We tend to assume we are a successful immigrant country and we don't really need to have anything more special. Perhaps, just by asking this question, we need to rethink that kind of assumption or even that kind of paradigm of thinking. Maybe there are a intergenerational aspect here, how just like when we talk about people surviving the Holocaust, that really transmits through generation. They're not really just by being safe for one generation. They're not really healed. There's a cultural, there's a family, at a community level, there are higher risks.
Thank you, Drs. Law and Anderman, for speaking with us today. To read the article we have been discussing, you will be able to find it online free of charge as part of the November 2012 edition of the journal Transcultural Psychiatry.
My name is Sophie G.
And my name is Alberto Sanchez.
And you have been listening to the Multicultural Mental Health Resource Center podcast.
For more information, please visit us at www.mmhrc.ca.
Until next time.